So I'm Hannah Reid and I'm Head of Health and Social Care. For Level 3 Health and Social Care BTEC we do lots of different units and they're all to do with caring for people and there's loads of different disciplines. So we start off with a unit on human lifespan development. So they look at the lifespan from birth to death and all of the different stages you go through and all of the physical and social and emotional stages that you go through. So that's sort of a core unit. But then we do lots of other disciplines. We do a psychology unit, a sociology unit. We do lots of work on public health. So there's all sorts of different units that you can be doing, and there's opportunities for work experience as well. And you can do a single or a double. So you can do the equivalent of one A-level, which is about 4 units, or you can do the equivalent of 2 A-levels, which is 8 units, which is great. We often have sort of the maybe more obvious ones, things like the sociology and the psychology and maybe a bit of biology, which kind of leads people to things like nursing and so on. However, we've had some really interesting ones. We had somebody doing DT and they actually did some work in their DT project to help disabled people and make a project in that way. So it can combine with anything. And I think the thing about health and social care, a lot of people think it's just about being a nurse or something, but actually if you want to work with people, then the stuff that we do in health and social care is going to help you in any context, so it doesn't have to just be you want to work directly in health and social care. I think it's a great subject because it has that vocational feel about it. So we are always thinking about, we're learning about this discipline, we're learning this theory like you would at A-level, but we're always thinking, how's that going to help people? How's that going to work with people? And how is it going to help me understand people better so that we can treat people with the best care that we possibly can? And so I think that is a really great thing. And the other thing is I think it does expose people to lots of different practical jobs and skills for jobs. So things like communication skills, things like initiative and those kinds of really sort of soft skills that are really important for any sort of world of work or even beyond that you're going into. And I think I really love seeing development of people that come into health and social care, wanting to care for people and having that sort of core caring nature, but to see them really build up the skills and the resilience that they need to work in a really tough industry. The pathways for health and social care include things like nursing often, and that's the one that people tend to think of, but actually the diversity of jobs just within the NHS is massive. I mean, the NHS is the biggest employer in Europe, so there are jobs in radiography, there are jobs, midwifery is really popular. We've had lots of successful midwives that have come from the college. We've also had people that go on to do things like business degrees afterwards, and actually some of the things they learn about working with people will help them in any degree. And also to remember that BTECs are really good at getting people into university. University love BTEC because it's independent and they're already project-based and they're already thinking vocationally, so don't feel like there's any reason why a BTEC won't get you to university.